Now, World Health Organization's Director General has raised concern over the inequitable distribution of COVID-19 vaccines in countries around the world. High-income countries have administered almost 44% of the vaccine doses, while low-income countries have done so at just 0.04%. Nesise has the rest of that.
WHO Director General Dr. Tedros Adhanom Ghebreyesus has once shown dissatisfaction over the inequitable distribution of world's COVID-19 vaccines. Half of the vaccine has been administered by high-income countries, while low-income countries have little or no access to the vaccines, a situation he described as a threat to all nations.
In countries with the greatest access to vaccines, we're seeing a decline in mortality among older age groups. In these countries, the public health and social measures that have helped to protect people are being eased, but they must be eased cautiously and adjusted in line with viral circulation and response capacities. With the increased global transmission of variants of concern, including the Delta variant, lifting restrictions too quickly could be disastrous for those who are not vaccinated. But many countries don't have that option because they don't have enough vaccines. In these countries, the continued use of tailored public health measures is the best way to suppress transmission.
Although there is a steady decrease in the mortality rates, especially among older people, Dr. Tedros believes that it is still too early to ease all restrictions.
The inequitable distribution of vaccines has allowed the virus to continue spreading, increasing the chances of a variant emerging that renders vaccines less effective. 6 months since the first vaccines were administered, high-income countries have administered almost 44% of the world's doses. Low-income countries have administered just 0%. The most frustrating thing about this statistic is that it hasn't changed in months. Inequitable vaccination is a threat to all nations, not just those with the fewest vaccines.
Chief Scientist at the World Health Organization, Dr. Sumaya cautioned that though the vaccine can prevent one from suffering from the virus, it doesn't necessarily stop one from getting infected or passing the virus to other people.
While these vaccines do reduce the chances of infection, they are not 100%. And so even if you've had 2 vaccines and you are protected from getting severe disease or ending up in the hospital, you might not be protected from getting the infection and passing it on to others. And there is a tendency, or there's a natural tendency for people to think once they've had the vaccine that they are protected, and there is a tendency to drop your guard and to stop taking all the measures like the mask wearing and the distancing that one would have done otherwise.
Equitable access to safe and effective vaccines is critical in ending the COVID-19 pandemic. However, the vaccination does not guarantee the need to throw safety measures away. The COVID-19 outbreak has seen over 174 million cases worldwide and more than 3 million deaths since 2019. Reporting for iAfrica News, I am Nesise.